Today we will be talking about cervical cancer and its disparity among African American women. Cervical cancer is a disease that develops within those who possess female reproductive organs and is the abnormal growth of cells at the lower part of the uterus and connects to the vagina. Although cervical cancer has little to no sign or symptoms in its early stages, it can become severe if discovered early on. Nevertheless, cervical cancer is highly treatable if detected in its early stages. Despite the widespread availability of screenings, Black women will remain disproportionately affected by cervical cancer when compared to other racial groups. Black women have higher rates of mortality associated with cervical cancer. Among the reasons for this disparity, Black women include a lack of timely diagnosis, regular physical examinations, practice of safe sex, sexual health education, and higher rates of sexual assault. Races and ethnicities other than white have historically been disproportionately affected by cervical cancer in terms of access to pap smear testing and HPV vaccination. The three biggest barriers faced are transportation, finance, and healthcare. While the pap smear is the most widely used cancer screening method in the world, there are still millions of women who do not take advantage of this discovery. We can see that despite its availability, those with uteruses have not yet taken advantage of the available preventative care due to the obstructions previously mentioned. Some organizations that provide these services are the Black Women's Health Imperative. This organization works towards a common goal of health equity for all Black women and adolescents. They use evidence-based practices and research to stress the significance of access to affordable and comprehensive pap smear and HIV screenings for women. This organization partners with local hospitals in areas that are high risk to help teach classes about comprehensive sexual education with a focus on cervical cancer and HPV.
For more information about the Black Women's Health Imperative, visit bwhi.org.
Some organizations you can check out are Cure Cervical Cancer Organization, USF Student Health Services, and Planned Parenthood.
Some of the organizations mentioned before incorporate the use of social media. Months such as January, where cervical cancer awareness is highlighted, people post using the colors teal and white to get the message across. Posting infographics like these to social media platforms such as Instagram and Facebook can let more people be aware of the importance of being vaccinated for HPV, how often people with a uterus should visit a doctor to receive a pap smear, and how important early treatment can be in slowing the progression. Another incorporation of social media is the use of hashtags, especially on social media platforms such as Twitter. The hashtag cervical cancer awareness is the most widely used one and should be used by other people if they're trying to get the awareness spread amongst their friends, family, and others that may contain a uterus. Another hashtag that's becoming increasingly popular within the community is Pap Snap, where people with a uterus take a picture of themselves after attending a pap smear to show the importance of keeping up with your reproductive health. Celebrities are also involved in using social media in order to spread awareness. When the Black Women's Health Imperative and Hologic's Project Health Equality organization combined, creating Serving Confidence, including celebrity Ciara, the artist, to help spread awareness to cervical cancer in the community of Black women. Within this collaboration, Ciara uses a multitude of videos to explain to the community how easy it is to get tested, where it can be available, and how it shouldn't be stigmatized within any communities.
Our creative solution for reducing the disparity for cervical cancer among Black women touches on all levels of the social ecological model. If an individual chooses to post or interact with a post regarding cervical cancer, they are educating themselves as well as their friends, which is stemming from the individual level. Friends seeing the post and becoming aware of the topic, that's the interpersonal level. And then if they decide to repost it and spread it on the platform, then that's covering more of the community level as well as the organizational level by being used on the platform. Due to the mass amount of people that are seeing that information, that influence can carry over into policy making. organizational level.
You can be a part of our solution to raising awareness for cervical cancer and eliminating the health disparity amongst the Black community. You can do this by participating in the hashtag PapSnap and hashtag Cervical Cancer Awareness Month, and also by sharing your knowledge about cervical cancer within your community. Like, comment, share, and follow for more information.